What's going on, guys? Good morning. Good morning. Let me know as you log in. Hello, hello, hello. Good morning, good morning, good morning. Maria, good morning. Good morning. Giving everyone a little bit of time to get logged in, and we will get started shortly here. If you have any questions, go ahead and fire away while we're waiting. Good morning, Levi. I see you. Good morning, good morning, good morning. Good morning, guys. Just gonna wait a couple more minutes here, allow some more people to get logged in. Got a couple things I'm going through myself. And again, let me know if you have any questions about the class. I'm getting everyone's names and stuff here. So hopefully everyone had a good weekend. Good morning, Jocelyn. Benjamin, good morning. Levi, I got you, bud. I got you. Let's wait a few more minutes. We got just over half the class logged in, it looks like right now. I'm going to write down a couple of things here, and then we'll get going. Again, if you have any questions, let me know. Good morning, good morning. Just waiting a couple more minutes here while I get some notes together. Then we're going to get rocking here. I wanted to check a couple of things here. What does it mean when my grade says T? What do you mean T? Like there's a letter T next to your grade? Or was something graded with a T? I don't know what you mean. Just so you know, and that's Levi. I'll take a look. I don't know. I've never seen a T. Last week I didn't do any grading. I got a little behind on grading. That's fine. I'll make up for it this week. Levi, I'll get to it. Give me till the end of the week. If you don't see a change, or if you keep seeing a T by the end of the week, just shoot me an email. But I don't know. Off the top of my head, I don't know what a T means. Yeah, no problem. Couple more minutes here. Couple more minutes. Couple more minutes. Let's see. All right. I'm gonna look in my backpack real quick, guys, and then we're gonna get started. Okay. All right. New unit. Okay. We wrapped up the first unit last week, which is just kind of overall wellness. A lot of it is really, really airy, really kind of loose. The next few units, things are going to tighten up a little bit. In other words, we're going to be a little bit more specific about the subject that we're talking about. So what do I mean by that? This new unit, sexual health, we will specifically address STDs in a very specific manner, which will start today. Do we miss points if you join late? If it becomes an issue, yeah, you will. What was I saying? So, specifically, we'll talk about STDs. Specifically, we'll talk about birth control methods. And as we get deeper into other units and deeper into the semester, when we talk about, nutrition and weight management, pretty specific stuff, right? So keep in mind. So the first part about sexual health is understanding that there's some statistical truth to sexual health, right? And it doesn't necessarily decide your sexual health fate or your general health fate, but it does play a significant role. So let's use this scenario, right? So let's say, let's combine two stats that are absolutely true. Okay. So according to the County of Santa Barbara, the North County or the Santa Barbara County Rape Crisis Center, right? In North Santa Barbara County, which is code for Santa Maria. So in Santa Maria, according to their statistics, you have a 1 in 2 chance of contracting a sexually transmitted disease if you have unprotected sex, right? A 1 in 2 chance. In other words, you have a 50% chance. For those of you who can't comprehend that percentage, if we were at the Chumash Casino and you had a 50% chance of winning, you by far have the greatest odds of winning that have ever been recorded in the history of gambling, right? In other words, those are really, they're damn good odds, real good odds. Let's also, let's combine that with another stat about STDs. And just a more of a general health stat, 70 to 75% of the population has HPV, right? Does anyone know what HPV is? Anyone? Bueller? Can anyone respond? Does anyone know what HPV stands for? All right. HPV is, and I'll type this in because I know some people have heard it, but they don't really know how to spell it. HPV is human papilloma virus. Okay, the human papillomavirus, and HPV is essentially warts, right? Um, Now you understand why 70% of the population has HPV, even though you've never necessarily seen a wart on your body anywhere. You most likely have them. HPV can be suppressed by the immune system pretty easily. But with that said, there are a couple of strands or a handful of strands of HPV that are sexually transmitted. And there's even a couple of those sexually transmitted that have now taken over the number one source of oral cancer, right? Mouth, tongue, throat cancer in the United States. In other words, HPV now provides more oral cancer to people in America than smoking or tobacco use does, right? So you combine the fact that 50% you have a 50% chance or a 1 in 2 chance of contracting an STD if you have unprotected sex in Santa Maria. You combine that with the fact that 70 to 75% of the population has HPV. The bottom line is, if your New Year's Eve got a little crazy and you woke up next to someone you don't know, or you had too many drinks at a party one night and hooked up with a guy from another school or a gal from another school or some girl in your class or whatever it is, do you have HPV? Statistically, I would say you do. It doesn't necessarily, obviously, that's not your fate, and that's not science. I mean, the bottom line is science is we need to find out whether or not you have HPV, and there's tests that show that. But there's just numbers. There's numbers that we need to pay attention to. So when you're evaluating your risk of contracting an STD, recognize the numbers, right? Recognize the numbers, and I'll explain what those numbers mean. So when you're evaluating your risk of contracting an STD, the first number is that you need to pay attention to is your age. In other words, are you between the ages of 15 and 24? Why? Because the vast majority of STD transmissions in the United States take place between the ages, or take place in people between the ages of 15 and 24. That's the cohort. Not that once you turn 25, your chances of STD diminish or are no longer existent, or even when you're 70. The chances of you getting it are still there, but the numbers of people around it and the amount of sex that you're having, the amount of partners, things of that nature, are going down, right? So when you're evaluating your risk, number one, are you between the ages of 15 and 24? My guess is everyone in this class, the 8 a.m. Monday class, health at Allen Hancock College, I can guarantee almost all of you, if not all of you, are between the ages of 15 and 24. Okay. Number two, have you had sex in the last 10 years? Right. Another number to pay attention to. Have you had sex in the last 10 years? And by golly, I hope you have. That would be a terrible dry spell. But why 10 years? What's the number? Why is that significant? For a very simple reason. Your body will interact with an infection. Your body will interact with a virus. It'll interact with a bacteria. And many STIs and STDs have a tendency to incubate, right? They have a tendency to lay low and not necessarily show their symptoms. And there are some STDs that people can live with for a number of years and not know they have it. There's a number of people that can live with herpes and HPV and not have an outbreak, but they can still transmit. There are people that have lived with hepatitis for 15, 20 years, and they never knew they had hepatitis. All the time they're doing damage to their liver. There are plenty of girls that have had chlamydia or gonorrhea and they didn't know they were infected. The symptoms can be very light. Maybe they have a little pain during vaginal intercourse, which is it's common. Maybe there's a little discharge from the vagina, which all women have a little discharge from the vagina. There are things that, the symptoms are too light. So the 10-year number, the bottom line is it gives you a good time span to recognize and experience the symptoms of disease, right? So again, number one, are you between the ages of 15 and 24? Yes. Have you had sex in the last 10 years? Most likely you have, because we have to, let me put it this way. It may not necessarily be vaginal sex, right? Or may not even have been oral sex. But sex is really what they mean is, have you put yourself in a risk of transmission? And you have to ask yourself, well, how do we transmit STIs and STDs, right? How do we transmit sexually transmitted diseases? Two ways, right? Two ways. One is what I call S to S, skin to skin, right? And that's how we'll talk about STDs the next couple of weeks. We'll talk about them either being a skin to skin, or what we call F to F, fluid to fluid, right? Or fluid to skin, right? So when you have skin to skin transmission, in other words, yeah, you can use a condom. You can use a female condom, and that will protect the penis and protect the vagina. But obviously, when you're having intercourse, there's other parts of the body that are touching. The foreplay or the pre-sex or the stuff leading up to sex, kissing, petting, things of that nature, maybe even oral sex, those are all forms of sex. So there's already transmission, fluid transmission, skin to skin transmission taking place, right? Or skin to skin touching, fluids mixing. So when you have a skin to skin transmission, all you have to be is within 3 inches of the infected area and you're considered at risk. Fluid to fluid, really depends on testing, but the fluids that can transmit disease are blood, semen, vaginal fluid, breast milk, right? And obviously urine, right? But the other one that people will often think that can, and it's not necessarily tied into a lot of sexually STD transmission, is saliva. In other words, saliva doesn't really seem to transmit a lot of STIs and STDs. However, if you have a cut in your mouth, or if you have an open sore in your mouth, then the fluid from that sore or the blood from that sore can be in your saliva. But saliva itself doesn't transmit STIs and STDs, right? So we have our skin to skin and our fluid to fluid or fluid to skin. And what do I mean by fluid to skin? You can get herpes in your eye. You can get gonorrhea in your eye. Okay. In other words, if you are having oral sex with someone and they ejaculate in your face, or you get vaginal fluid in your eye or in your nose where there's a mucous membrane, you can transmit gonorrhea. You can transmit chlamydia. You can transmit really any fluid to fluid transmitted STI or STD. In other words, you can get gonorrhea in your anus, right? You can get gonorrhea in your throat. Although gonorrhea, the main site of symptoms and the main site of infection is actually the urethra, you can get gonorrhea in other places, right? You can get herpes up high and down low, okay? You can get herpes in your eye. So again, skin to skin or fluid to fluid transmission. Have you had sex? In other words, have you had skin-to-skin contact or fluid-to-fluid contact or fluid-to-skin contact? Okay. So again, number one, between the ages of 15 and 24, sex in the last 10 years. Number three, have you had multiple partners, right? Have you had multiple partners? What's multiple? More than one. I mean, that's it. That's it. That's the bottom line. Have you kissed more than one person? Have you had oral sex, anal sex, vaginal sex? Have you fooled around, hooked up with more than one person? Crucial. And the reason being is when you have a skin-to-skin transmitted STI or STD, like let's say HPV or herpes, right? The more people you come in contact with, you're not only coming in contact with all the people that they've hooked up with, but you're coming in contact with all the people that all those people that hooked up with them have come in contact with. So look at it like kind of like the coronavirus. The coronavirus, not that we shouldn't respect it, because it is highly contagious, but what we're really looking at is the way every virus transmits, right? I don't necessarily mean how it transmits. What I mean is how every virus moves its way through a population, right? So what happens when you have sex with multiple people? You are at a greater risk of allowing that virus to move through you, right? To continue to move through the population, right? So protecting yourself, mainly by the male condom, but by other sources is really important, because what we're trying to do here is evaluate at one end of the spectrum, low risk sexual behavior. At the other end of the spectrum, high risk sexual behavior, right? So on that spectrum, some of it is the type of sexual activity that you have. The other part of it is related to how many partners you do it with, right? Does that make sense? So kissing, you've had one boyfriend or one girlfriend in your life, and all you've done is kissed her or kissed him, low end of the spectrum. My guess is you probably do not have STDs, or maybe have not even come in the risk of contracting an STI or an STD. If you've had unprotected sex with multiple people, if you've had unprotected anal sex with multiple people that you don't know, that is considered very, very risky behavior. I would say that you are at a very high, you're at the very high end of the spectrum for contracting an STD, right? So the numbers help us evaluate the risk. And again, not only is it the number of partners we have that put us at the low end of the spectrum or the high end of the spectrum or somewhere in between, the type of sex that you're having, right, plays a role as well. Okay. And then lastly, the last thing, have you been tested? Have you been tested, right? A sexually active person who is active in and proactive in maintaining their health will be tested at least once a year. At least once a year, if not twice. And there's a couple of reasons for that. Number one, we're not good at evaluating disease. A lot of people have a tendency to write things off as, oh, this or that, or I don't feel good, or this isn't necessarily a symptom, or blah, 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 so on and so forth. The bottom line is you're not a trained eye. And the other thing is, particularly for the females, if you have gonorrhea or chlamydia, and we'll talk about the numbers, okay? The bottom line is statistically, there's probably about 5 girls in this class, right, that will get chlamydia at some point in her life, statistically. Those symptoms can be so light that it's fairly common to have a chlamydial infection for a while. And the bottom line is the longer you have chlamydia, the longer you have gonorrhea, the higher risk you have for what we call pelvic inflammatory disease. And we'll talk about this a little bit, and I'll try to send out some graphics. But the bottom line is, a female's organs look like something like this. The ovaries are here, and then we have some tubes going down to the uterus. Those tubes are called the fallopian tubes. Inside the tubes, there's like these little hairs that help facilitate movement, egg movement, right? And those can become very inflamed. They can become inflamed to the point that they become very stiff and rigid, and you basically render yourself infertile, right? But even the same thing with guys. The bottom line is you don't have a trained eye to locate HPV. You don't have a trained eye for really any disease symptoms, right? So the good thing about going to a doctor and getting tested, or going to a clinic and being tested, is the sooner you catch the disease, the sooner you stop the spread, the sooner you get better, right? So the bottom line is getting tested regularly is crucial, right? Very crucial. So again, back from the top, evaluating your risk. Number 1, are you between the ages of 15 and 24? Yes, you are. Number 2, have you had multiple partners? 3, evaluate that spectrum, right? How many partners have you had? How many times have you had sex or sexual activity? Doesn't necessarily mean vaginal sex or oral sex, but have you kissed someone or hooked up with someone? And has it been protected? Think skin-to-skin transmission. Think fluid to fluid or fluid to skin transmission. Have you had sex in the last 10 years? Right? If you've had sex in the last 10 years and you haven't been tested, go get tested, right? Go get tested. And then lastly, the bottom line is the very next thing so abstinence, right? We know what abstinence is. It's the no sex, having no sex at all, practicing no sex. In other words, you're making a conscious decision to not have sexual intercourse, right? The very next thing next to that, as far as being on the safe end of the spectrum, is having sex with just one person, right? So every time we have sex with another person, we are allowing those viruses and those bacteria to move their way through the population, right? You're giving that thing an avenue to move through you. And depending on your health, some people, it can significantly affect your health. I mean, there's some people, if you have herpes, you'll have an outbreak once a month and they're not comfortable. It doesn't feel good. Depending on how your body handles HPV, ladies, there might be a part of your cervix that's taken out. Guys, you may get throat cancer, penile cancer, tongue cancer, depending on how your body handles it, depending on what type of strand you get. So with that said, evaluate your risk and change your behavior accordingly. But here's the one thing I can tell you, right? Here's the saving grace. I'm not trying to scare you into not having sex. By all means, do what you got to do. But wear a condom. I mean, it's got to be the best thing that you can do for yourself. One of the healthiest decisions that you can make for yourself. And why do I say that? In fluid-to-fluid transmission, we see, I'm going to type this up so you can see it. Fluid-to-fluid transmission, you see an 80% reduction in STDs when you wear a condom. Fluid-to-fluid transmission, there's an 80% reduction, right? That's amazing. I mean, obviously, we're talking about the condom catching semen and not allowing it to penetrate the vagina, right? Good. That's a good thing. So you say, well, what about skin to skin? With skin to skin transmission, we see a 50% reduction. Those are great numbers, guys. Great numbers. And to be completely honest with you, in America, you can't say this for other countries. In America, if you wear a condom and you keep your partners relatively minimal, the chances of you getting something like HIV or AIDS is freaking small. It's really small. Now, that changes with a couple of different groups. I mean, if it's men having sex with men, the numbers have a tendency to go up. If it's men having sex with transgender people, the numbers have a tendency to go up. If it's people who use intravenous drugs, like who shoot up heroin or whatever other drugs you shoot up, the numbers go up significantly, right? In particular, when we're talking about HIV and AIDS. But if you're just a regular old Joe, okay, I got a question. Okay, I'll answer that in a minute. So if you're just a regular old Joe using a condom every time you have sex, your chances of contracting an STD go down significantly, right? So we have a question from Roman. I have a question. If you have sex, for example, 5 times with no condom, is it possible to get an infection? Yeah, dude, absolutely. If you have sex with a condom, it's possible to get an infection. If you're worried about it, you probably should be. Go get tested. If you're worried about it, go get tested. If you're not worried about it, go get tested. If you think it's for some reason it's someone that's going to give you an STD, don't have sex with them, right? But yeah, absolutely. Every single time you have sex, every single time you physically touch or physically engage with someone, there is a chance that there is virus and bacteria that are moving through the population, right? And albeit sometimes it can be low. But I mean, just look at like UFC fighters. You see them punching each other and they're both bleeding all over the place. Very few people transmit HIV by UFC fighting, or really any diseases by UFC fighting. But there still is a chance that they are going to transmit something. So yeah, Roman, 100%, dude. Go get tested. Okay. All right, guys. Here's your question for the day. Make sure you get that done today. And then again, on Wednesday, make sure you do your assignment. Next week, we'll get into specific STDs, right? We'll talk about fluid-to-fluid STDs. We'll talk about skin-to-skin transmitted STDs, and then we'll kind of move on from there. Okay. Your question today is you are going to locate 2 places in Santa Maria or wherever you live that you can get an STD test. What you need to type in is the name, the address, the cost. So that means, yeah, you have to call. You have to call. You have to call and ask, right? Find out the cost, right? And find out what they test for. Actually, you don't need to do that. Just give them the name and address of 2 places in town. Okay, 2 places in Santa Maria, or if you live in Napomo or whatever, local. Find 2 places that you can get an STD test. Name and address of 2 places in town. Okay, that's all you got to do. Type in blah, 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 1501, blah, 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 next name, and that address. Okay. If you have any questions, shoot me an email. Pretty straightforward today. Just assessing the risk of sexually transmitted diseases. Is the assignment on Canvas yet? The assignment's, yeah. What do you mean? Yeah, I'm looking right now. Hold on. Let me make sure it's on Canvas. I'm not sure why you're asking me that. Give me 1 second here. 1 second. Yeah. Yep. Yeah, that's fine, Nathan. Whatever. Yeah, just find a local place. Santa Ynez, Lompoc, 2 in Santa Maria, 2 in Lompoc, 1 in Santa Ynez, 1 in Santa Maria. Doesn't matter. 2 places, 2 local places that you can access that do STD testing, right? Give me their name and address. Okay. All right, guys. Deuces. I'm out. I'll see you next week. Make sure you get your assignment done today. Make sure you get your assignment done Wednesday.